Uh, this is Dr. Garais, MED120, Monday evening, Labor Day, and today is September 7th. Now, I'm going to go over not the entire exam because that's just a waste of time. Let's go over, I'm going to go over the ones that a lot of people got wrong. Overall, class average for the exam was, I believe, in 83, 84. Not bad, pretty decent. But you guys got caught on certain questions that, honestly, I kind of warned you that they would come. So let's look at this, and I have the list of which questions, because I do data analysis on all my exams to see if they're statistically correct. Now, another thing that you're also going to look at when you look at your exams, those of you who get like 4 or 5 wrong in a row, that's telling you something. That means for that particular section, you were cramming. And I could tell who studied, and if you studied well, you should have like a couple of things wrong here and a couple of things wrong there. You know, you can't win them all the time, but you shouldn't have a whole bunch of consecutive numbers in a row. And the way I design my exams is that I, what's the best way to put it? That I put certain things together and to test certain things to see what parts of the lecture did the class overall retain and what parts of the lecture that you missed. And the one that almost everyone missed was the one that I warned you guys about. Number 8, identify the combining form in the medical term arthritis. And remember, a combining form requires what? 2 things. It requires a root. It requires a root and a combining vowel. So in the term arthritis, even though you don't see an O or a combining vowel, you're being asked the combining form. And a combining form is always some sort of root, which is Arthur, which is the root of arthritis, and some combining vowel, which is 99% of the time O. So the best answer for identifying the combining form was C, both, for number 8. The other ones are pretty straightforward, and here, a decent amount of people got week 2 lecture wrong, which is items like 20, 21, 22, 23. So you look at 21, which of the following medical terms means many tumors? So immediately you know it's from week 2, you're talking about singular versus plural. So of course, sarcomata, you have to be able to identify which one's singular, which one's plural. It can't be both, right? It can't be neither. It's got to be one. So we already know that a sarcoma is a tumor, and 21 in many tumors is what? Sarcomata. 22, your patient injured L2 through L4 backbones. So that means injured multiple backbones. So multiple backbones is vertebrae, okay? And that's number 22. Okay, what's the other one? Let me look. I have a little list here. A couple of you got the second half, and this is also another thing I noticed. If you're having some test anxiety, your first set of questions will go wrong. Okay? That's another thing you have to do. Not only look at what's right and what's wrong, you have to look at your answering pattern. And this is the same thing for T's. This is the same thing for NCLEX, MCAT, GMAT. Um, you take multiple exams and then you analyze what went wrong. So typically, if you have like some sort of testing anxiety, your first set of questions or the first dozen in a 50-item multiple choice examination, you're going to get a lot wrong. And there's some people, there's one or two of you I'll talk to, I've identified that the first half, the first 25 looked very different than your last 25. So it shows that you were stressed out in the beginning, and then once you got more comfortable with the exam. And it also goes to show you that you got to check your answers. That was another thing that I saw, that many of my questions come in pairs or triplets, and it's asking relatively the same thing. And then I noticed that you'll get one part of it right and the other one part of it wrong. That means you got the concept down for the part that you got right, but how did you get another question that was just like it wrong? And I can tell you right now, it's probably you mislabeled or mistransferred, or remember our protocol. You have to, at the end, like let's do number 2 as an example. What is the root part of the medical term pelvimeter? So I have to ask myself, what's the root? The root's got to be the main word. Meter is the end, pelvi is the front. So it has to be what? Pelvi, right? So so the root part would be B. Then I have to ask myself, does the root come in the beginning or the end? Because this is in the beginning, therefore that's the correct answer. And you check and you go through that each one. And then at the end, when you're all done, because the majority of people finish this exam, that's another thing that I also do. I write down how long it takes you to finish the exam. On average, it was 39 minutes. And also the other thing I also noticed, people who did the exam crazy early didn't get the best scores. The people closer to 39 to the 39-minute mark got the best scores. That means what? Those of you who finished really early, you probably missed a couple that you shouldn't have missed. So that's also part and parcel about learning how to take an exam, pacing. Now, on the exam, when I send it to you, there will be 2 numbers. There'll be an exam score, the actual score out of 100%, and your overall midterm grade. Now, your midterm grade is not a real grade yet. It's not something that will go on your transcript. So let's say you have a B- for the term, for the midterm grade. You have this week included 5 more weeks to do something about that. So if you're in a B- range, right, you're still within range to an A-, okay? So, or even higher than that, because the course is only halfway done, okay? So with that being said, for those of you who have A's, just know if you mess up the second half, it easily can turn into a B- if you don't keep up your work. And those of you who have like a B or B-, there's still hope to get that A or A- or higher. So keep your due diligence. Keep on turning things even they're late, because I'm always about the exam that you were reviewing was not the one. Oh, let me look at that. Let me check that, Ms. Guevara. If I sent you a different one, let me check. But overall, that's how you do analysis on a multiple choice examination. Now, question: how do you see your grades? Those of you who recall your if you were at orientation, go into you can also go into your grades here. Like once you go in, there's grades on the side. It can look at your grades. Look at all the way to the far right, and it's base 100. But the official grade in the system, you can also look into your student self-service portal. And when you're here, where is it? Resources. You go up here. This is your Moodle. When you go into resources, click on self-service portal. Utilize the same credentials that you did to get into your Moodle, and you should be able to see your grades and also other things as well, like your transcripts and you're also what is called your academic plan. But those of you who are in nursing, you will be probably getting a call from me or Miss Briscoe sometime in the next couple of days regarding your registration. Registration is underway, but make sure, because I have a couple of nurse candidates who already started registering for a class without talking to me. You might be taking a class you don't have to, or you might be taking a redundant class. So please reach out to me if you're a nurse candidate, BS Health Science, and have yet to apply, and you're not quite sure of which is your next class. But I'll be scrubbing that list all throughout this week, Tuesday through Friday. All right. So now the next thing that we're going to get into this week, and again, I'm going to keep this short because I will have a video lecture. Now, let's now look at cases, because we've already had 4 weeks of what's the prefix, what's the suffix. We're going to take it a little bit further. So let's look at some of our previous chapters in our medical language laboratory. Let's see if it works this way. Where's my Firefox? Put this address here. Ugh, this is now annoying. Let's do it this way. Get in this way. So let's look at another chapter that we already went through, and then let's look at the case and your final exam. There's an online final exam, but you could use that for practice. Your online, since almost like 85% of the students took the midterm exam online, it has been suggested to me by my campus president and my dean that maybe we should just have all the exams online. So for the final, I'll get instructions. But your let's go into an ebook. Your final written examination will be, of course, focused. It'll be cumulative, but it'll be focused on weeks 5, 6, 7, 8, and 9. So let's look at let's look at the respiratory system. And if you go into the back of the chapters, you'll see this medical record activities. So when you go there, you'll see cases. Now, case studies are neat because it provides the student a little bit of real world experience without getting your hands really dirty. So let's look at this. Now, the neat thing about the way they do the cases is, first, of course, you have a case, and I'm gonna break that down for you in a moment. It actually outlines all the main terms that are in said case. And it even takes it a step further. It asks you questions regarding the case. Now, it is in your best interest to learn how to do cases, because guess how your NCLEX is designed? It's designed as a set of case study questions, or what they call clinical vignettes. So they give you like a little story, which is like this, which is essentially what a case is. And then they'll ask you questions on it. Okay. So yes, you're going to still have some questions like, what does this word mean? Or what does that word mean? But now it's going to be, what does this word mean? What does that word mean? But in context of what's going on in the case. So for example, what surgeries did my patient have? What was the outcome of the last year's surgery? What seasonal symptoms are currently noted by the patient? You now will have actual questions that will be asked of you in real life when they're talking about a case. Because I can tell you right now with all certainty, oopsies. Why won't it go back up? I want to go back up. There you go. I can tell you right now with all certainty, no one's ever going to ask you what does septoplasty mean? What's turbinate reduction mean? They're not gonna. No one's gonna ask you a straight up medical terminology definition question. But what will they ask you? What was done for my patient? What was the reaction of my patient? Who saw my patient? And knowing medical terminology will help you answer those questions. Now, before we get down to this, let's look at what a case is composed of. And some of you may know what these things are. Cases are composed of four parts, and some of you who work in the business or have had previous training, a case or a typical chart of a patient is composed of four things: subjective, objective, assessment, and plan. Now, the subjective part is any history. So what things are included in the history? CC, which is the chief complaint. History of present illness, which is anything that has to deal with the chief complaint. The chief complaint pretty much is in the patient's words. What brought them to see us. And the history of present illness is not all of their histories, but just the history related to the chief complaint. For example, I'm pre-diabetic, I have hypertension, I have some joint disease. But if my chief complaint was stomach ache and it started 2 days ago, I only should be talking about to the doctor, or the doctor should be only asking me about the chief complaint and the history related to the chief complaint, and that's your HPI. Then of course you have SH, which is social history. That's everything you do at a party: smoking, drinking, sexual activity. PMH, which is past medical history. And that's all the other stuff that may or may not be related to the history of present illness or chief complaint. So the subjective, that's anything about the subject, our patient, any history, past medical history, social history, and past medical history also includes all surgeries. So, you know, when you hear words like signs and symptoms, symptoms are highly subjective. Symptoms are what the patient feels. Example, pain. So pain, I don't know, I'm in pain right now. It's highly subjective. It could be really painful to me. It couldn't be. It's hard for you being outside of my body to know what that is. So who's the only person who knows what that is? It is your subject, your patient. Now, objective are your physical examination and your laboratories. Okay. Any tests that I did to you, ultrasound, CT scan, MRI, all of that falls under the objective. And those are signs. Those are things that I can see. For example, All of us know what a stop sign looks like. It's red, it's octagonal, and it says the word stop. Same thing for a fever. A fever can be objective if I was there to take the measurements. And if the measurements are there, 98.6 degrees Fahrenheit, you see it, I see it, we all see it. But if I don't see it, for example, my patient had the fever at home, that becomes a symptom, how my patient feels. A sign is what we actually see, something called objective data. The combination of subjective and objective data is how we get the next thing, which is assessment. Another word for assessment, diagnosis. And we already know a diagnosis is state or condition of complete or thorough knowledge. What complete or thorough knowledge? All of my subjective data, all of my objective data, all of that together, I can now give you a diagnosis. So in a diagnosis, that's why, remember our week 1 lecture, I can't tell you everything. If the entire physical examination isn't done, I can't tell you the diagnosis unless all the laboratories are back. And I can't tell you everything if you don't tell me the entire story, which is your history, or if I don't get the history from your previous doctor, okay? And last but not least, your plan. Your plan, also known as your management, MX. Oh, and the abbreviation for diagnosis is DX. Now, what's in your management? Everything that I'm going to do to you. I could have your medications. What other specialists will you need to see? What else? What further tests that we need to do? What else is in management? Essentially, medically managing you. What are the specialists? What are the procedures? What are the further tests? And another thing that's included with this management, which is kind of related to assessment, is prognosis. My prediction. And based on my prediction of before knowledge, that is how I get to send you to what specialist or what medications you'll need, or what further tests you may need, and the time frame of how that goes. So when you look at a case, start looking at the case like this in parts. So with that being said, let's look at our patient here, Juanita Harding, ENT Hospital Clinic, Dallas, Texas. And this is Dr. Gardner. This is to Dr. Gardner from Dr. Perez. So when we look at this, saw Miss Harding today for complaints suggestive of allergic rhinitis. So right off the bat, couldn't I ask you what was my patient's chief complaint? Chief complaint was allergic rhinitis. Inflammation or infection of what part of her face? Her nose. And does she have a past medical history of any nasal problems? Yep. Long history of nasal obstruction. Previously, she was found to have mechanical destruction secondary to septal deformity and turbinate hypertrophy. So what happened? Her septum, which is the piece of cartilage that separates the left and right nares, or the holes in her nose, was deformed. And she also had the spaces inside her nose called turbinates. They were hypertrophied. So I can ask a question about that. The turbinates, did they enlarge or did they shrink? Hypertrophy is excessive growth, right? So they enlarged, and that probably added to the nasal obstruction. On top of the septum was also deformed. What did we do? I goes, what did we do for her in the past? Well, she had a septoplasty. What did we do to that septum? Did we A, remove it? B, did we sew it up? 3, did we repair it? It goes 4, we did nothing. Of course, plasty means repair. What did we do to the hypertrophy? Because we did turbinate reduction. That means we did an ectomy, right? So could be a turbinectomy. We reduced the amount of tissue because it was all hypertrophied. And when did they do that? the latter part of last year, so late last year. What was the management? Well, it improved her airway. She was noted to have seasonal nasal symptoms of sneezing, watery rhinorrhea, tickling of the palate, and burning of the eyes. Whoa, doesn't that look like a all of the above question? Because of her seasonal nasal symptoms, which the following did she have? Rhinorrhea. She had a decent amount of postnasal drip, meaning stuff was coming out of her nose. She had itching of her palate, and the palate is the hard top part of your mouth, and she has burning of the eyes. And when does it exacerbate? Was it the winter, spring? It was spring and summer months. So you could see here, anywhere that there's a medical term, I could easily ask you about it. Experiencing symptoms again at this time, she was noting that she has nothing that would suggest recurrent sinusitis. That's a nice question. Is the physician entertaining recurrent sinusitis? And according to this paragraph, no. So do you see this whole paragraph is her history? And that's got to be the subjective part. Now look at the objective part. Her examination today revealed unremarkable otoscopic findings. So what did we do to her? I put an otoscope on her. What's an otoscope? Scope is a instrument that views. Otto means her ears. Nasal exam revealed essentially midline septum, so the repair worked with improvement of the nasal airway, secondary or status post, septoplasty. You're going to see a lot of that in charts. You're going to see something like this. Patient was seen today. Improvement. It goes on airflow. Secondary, and then this is two with a little like this. This is the shorthand. You're going to see something like that. Secondary to status SP or status post septoplasty. And you can see here, SP means status post. That means post means after. We already did it. And then we'll say it was latter part of last year. So it was like what? November 2019. So that's what it would actually look like in real life. And SP means status post. Something was done. What was done? Septoplasty. And it mentioned in the history that it was the latter part of last year, which is November 2019. What else? What kind of questions? Turbinates were lateralized inferiorly. So when we cut them, where did we cut them? We cut it on the side, lateral, and then it goes, and also the bottom part. So we cut it to the side and the bottom. Mucosa, however, the nasal cavities, somewhat pale and edematous, right? So I could ask, what color was it? Was it more bluish? Was it red? It's pale, so it's more bluish. And edematous. Edema means that it was swollen. And it also had some serous discharge. Sinuses were non-tender. That means they didn't hurt. Nasopharynx was clear. That means the nose and throat area were essentially clear. Oral cavity and oropharynx, which is the oral cavity and the throat area, were without any mucosal lesions or indurations. Indurations is like things that fold over and pit inwards. That's the best way to, most layperson way I could talk about it, describe it. Neck was unremarkable to palpation. Another word that they'll also say, palpation means to feel, right? Now, it's not this, it's kind of the same as cardiac palpations, but it's a different story. A cardiac palpation is when my patient is having palpitations, normally you don't feel your heart beating, but if you're nervous or you have a cardiac pathology, you'll feel your chest beating or your heart beating, and that's called palpitations. This is palpation, and palpation means to feel. So neck was unremarkable to palpation, and sometimes they will also say neck was supple. S-U-P-P-L-E, meaning it was soft. Because if you have any pathologies in your throat or hypertensive crisis or anything of that matter, your neck will be a little bit harder than usual. And last but not least, we already went right to assessment. My impression, right, which is Dr. Perez's impression, based on her symptoms and finding, what was her diagnosis? Allergic rhinitis. What was her management? She gave Vancinase AQ and Allegra. However, it would be best for her to see an allergologist to undergo definitive allergy testing. So, what kind of doctor is Dr. Perez? She deals with what? The sinuses, the nose, right? So she's an ear, nose, and throat specialist. And an ear, nose, and throat specialist is, let's write it here, Otto Rhino Laryngologist. Laryngologist. So it's a person who practices or studies Otto, ears, Rhino, nose, Laryngo, throat, also known as ENT specialist. ENT is ears, nose, and throat. So because every chapter that we've ever done, we always talk about who are the people in our neighborhood, right? She's writing from an ENT hospital clinic. Hence, Dr. Perez is probably ENT and probably has other letters at the end of her name. Those are board specialist people. And she was either writing to Dr. Gardner, her primary, Juanita Harding's primary care physician, or she is asking for some help from Dr. Gardner. Dr. Gardner may be an allergologist or an allergist to help her with her allergies. So you could see the words that the textbook feels that's important, but you could see just by me going over this, there's a lot of words here and there's a lot of questions that I could easily ask. But now that you have the archetype on how a case would go down, don't you think you can easily make questions based on what you read, based on the terminology that the textbook is highlighting, and based on this as well? Can this easily be a multiple choice question? What surgeries did the patient have? A, septoplasty. B, mammoplasty. C, appendectomy. D, what else did we, pharyngostomectomy. And of course, we talked about in her history, she had a septoplasty. What was the outcome? It was pretty good. How do we know? And remember the physical findings upon the physical examination. Does she have any seasonal problems? Yes, we talked about that. It was what? Spring, summer. Nasal mucosa. Was it goes red? Was it blue? Was it shrinking? Was it growing? Was it edematous? Or edema is another way of saying that was full of tissue fluid. And last but not least, what's the recommendation? Could I ask, what are we asking Dr. Harding to do? Dr. Perez is asking Dr. Harding, can we send her to an allergologist? Okay, so that's a breakdown of just one case. So look at your previous chapters, and the discussion for this week 6 going into week 7 will, I believe it's urinary. So I will highlight a urinary case and you try to figure out what's important. I'll have instructions momentarily. And the lecture proper, again, like I said, I'm trying to cut this short. The lecture proper, I will get a video from last term and I'll put that up as well. All right. Does anyone have any questions on how we are to look at cases? And we're gonna, every week now until the end of this course, at the end of every chapter, we're gonna go over the cases. But I would like for you now to look at the previous chapters that we went through and look at the end where it says go to medical record activities and start looking at some of these cases. And every chapter has like 2 of them. So we did integumentary. So you go in medical record activities, and then there'll be a, if it's cooperating with me, there'll be an integument case. There you go. Oh, looky here. Right? Isn't this looks like it's subjective, right? Detect early solar keratosis, right? This looks like a physical examination. Okay, I can ask questions about that because remember, your final exam is cumulative. Every chapter that we ever went through, but it will be done in a case study format. And where am I going to get the case studies? From your textbook. And in each chapter we went over, there's at least 2. So do you think now until week 10, week 9, you could look at each and every case and pretty much figure out what questions I could ask? Yeah, you could easily do that because you have all the cases, you know which chapters that you already did, right? And they give you the words, like for example, let's look at this idiopathic glutatate hypomelanosis. So what happens in idiopathic glutatate hypomelanosis? What happens to, because is what happening in this particular diagnosis, is it normal or an abnormal problem? Well, we know from the suffix, it's abnormal. What's happening to the melanin pigment? Is it getting increased or decreased? Hypomelanosis, it's getting hypo, decreased, right? Where do you get solar keratosis from? Abnormal condition of what? Solar, sun. You get it from exposure, okay? So you could pretty much start to preempt me and pretty much start to predict each one of the chapters on what could be on the exam. And every week, I'm going to have you guys in the discussion section start preempting me and start looking at the case and start guessing on what kind of questions could come out. And now that you have some of these examples for this week, it is, so we're in module 6, I believe it's urinary. Yep, we're in urinary system. So for due next week, the discussion forum is, let's write it out. Is to not take a look at, choose one case from the end of the urinary system chapter and create a 5-item multiple choice quiz based on your chosen case. Okay? And of course, don't forget, I think everyone except for 1 or 2 of you is caught up on the quizzes. Please kindly catch up on the quizzes. And other than that, quizzes, medical language lab, almost all of you are caught up. I will do the grading for the week 5 stuff. But overall, that's all I have for this week. Anyone have any questions? Okay, and Ms. Guevara, let me look at your exam again, let me look at it to see if I gave you a different version. Okay, but if that's it, I'm signing off for this week. Nothing. So everyone enjoy your day or the rest of your day. Please look out on your email probably tomorrow morning or later tonight. I want to see if I'm going to try my wife's printer to see if it'll scan your exams for me. But if not, I'll do it tomorrow morning when I'm back on campus. All right. If no one has any comments, thank you very much, everybody.